assessment. Cassie is going to be videoing me, so she's going to do a view of the room. Okay, first I want to start and say, I know that a pediatric stethoscope is supposed to be used. We don't have one, so we're going to use the normal stethoscope for video purposes. Also, there's no weight being gotten. There's no head circumference, chest circumference, length, or blood pressure. I know that blood pressure is approximately 40/86 as a normal range, but we are skipping that on our assessment today. So, here we go. We are going to knock, knock, knock. Good morning, Joanne.
Good morning.
How are you today?
I'm doing good.
Good. My name's Sheena. I'm a student nurse, and I am here to do an assessment on Charlie Ann. Is that all right?
That's fine.
All right, perfect. First, I need to check that your wristbands match. She has one on her left arm here and one on her right foot. So we have to check both of them. Is that all right?
Oh, yes, ma'am.
All right. I'm just going to unswaddle her a little bit and check her out. Okay. Joanne, can you verify your full name and date of birth, please?
Joanne Jones, 12/3/1967.
Okay. And Charlie Ann, all wristbands match. Good deal. Okay. I'm going to get the assessment table if that's okay with you, Joanne.
Oh, yes.
All right. I'm going to do hand hygiene again. Here we go. Going to put gloves on. How are you and the baby doing?
Oh, we're doing great.
Yeah, good. Good deal. Okay, here's my assessment table. My height here. Do you mind if I take Charlie Ann?
Oh, no, you can take her.
Okay, support the head. First observation, I see that Charlie Ann is nice and pink. All right, gently support the head. I can see that her eyes are symmetrical, bilaterally. Symmetrical to the nose, the inner canthus to the top of the ears. I can see that she does not have a cleft lip. If I'm going to check for a cleft palate, on the soft or hard palate, I can use my finger to feel around, or I can use a pen light as well. I'm going to palpate lightly the top for her anterior and posterior fontanelles. I can feel that they're flat, they're not depressed or bulging. That's good. Her sutures I can feel are overriding, which is good as well. She feels dry. Again, she's pink. I'm going to unwrap her a little bit here. All right. You can see she's not in any distress. So we are going to start with her temperature. I'm going to ensure that there's skin-to-skin contact under the axilla. At the same time, I'm going to listen to her count her respirations for 1 full minute. Then I'm going to move on to lung sounds. I can still see that she is pink, warm, and dry. No signs of cyanosis. I'm going to use the diaphragm of my stethoscope. Alright, I'm going to listen to the apical pulse for 1 full minute while her temperature is being gotten. Okay. At this time, I would also listen for a murmur. If there was a murmur, it would be normal at this age. Being without is not abnormal either. Okay, I know that a normal heart rate is between 110 and 160. We got 150. I would listen to the beat and the rhythm before I would start counting to ensure that I can count as fast. Listening to her respirations. I know that a normal respiration for an infant, newborn, is between 30 and 60. Listen for 1 full minute. She's at 40. It's good. I would listen to lung sounds bilaterally from right to left. Feel like I'm shouting with the stethoscope on. It's good. I do not see any signs of bruising. I don't see any scratches, any birthmarks so far. Her arms range of motion is good. I can see if I were moving her around that her collarbone is intact. Her nipples are symmetrical. I'm gonna take this off. I'm not screaming. All right. Charlie's thermometer beeped. Normal temperature is 97.7 to 99.8. She's at 97.9, which is good. Set that aside. Okay, she has all 10 fingers. I'm gonna unravel here a little bit. I'm gonna check her umbilical cord. So I'm gonna undo a little bit here. She has 1 clamp, which is good. Everything matches. Her clamp, her wrist, and her ankle bracelet. I do not smell any odor. There's no redness, swelling, no sign of infection. This keeps falling off, so I'm just going to set it aside for now. I'm going to undo some more here. Perfect. I'm going to move her legs. Watch for any signs of distress or pain. I do not hear any clicking, which would be an indication of hip dysplasia, excuse me. Upon her breathing, I do not see any signs of distress, labored breathing, retractions. I don't see any accessory muscles being used. It's normal for a baby to breathe with their belly, so that is not what I'm speaking of. It's good. And feel she has all her 10 toes. Doing a cap refill is less than 1 second return, which is good. All right. Joanne, can you tell me the last time that Charlie had a bowel movement?
Oh, it was about an hour ago.
About an hour ago? All right. Well, next time she has a bowel movement, will you let me know so I can come and see the color and consistency?
Oh, certainly.
All right. And then I'm going to check and see if she's wet. I'm going to listen to her bowel sounds real quick. Make sure they're active. Perfect. Undo the diaper here a little bit. Just below the umbilical cord. I would listen in all 4 quadrants. Right to left. Perfect. They're active in all 4 quadrants. Great. Okay. Now we're going to get rid of this diaper. We're going to check genitalia. Everything looks normal. Female genitalia. She did urinate, so we are going to change her diaper, do pericare front to back. All right. I do not see any cuts, any bruising, any birthmarks. I'm going to listen to her lung sounds in the back. The diaphragm on my stethoscope. I'm going to roll Charlie over. All right, support the head and neck. I'm going to listen right to left. Listen bilaterally, side to side to compare. Sounds good. Oh, here we go again. Okay. As she's over, I would tuck a new diaper on, clean her behind. I can see her spine is straight. There is no dimpling, no tufts of hair, no signs of spina bifida, no bruising, no breakdown, no scratching, no redness. I can see that her anus is patent. Everything looks good. Okay. Her gluteal folds are symmetrical. Thigh folds are even symmetrical. That's good. All right, I'm tucking a new diaper under, supporting the head. Again, she has all her 10 fingers and all her 10 toes. I would document all of this information. At this time, I can check after I change my gloves because I just did pericare. Change my gloves. I could check the Babinski reflex on the bottom of her feet. Just give a little, not scratch, but push. And then her toes are gonna splay. I can do the rooting reflex where she would look for food. Those are intact. No sign of pain at all. Active range of motion, spontaneous movement. She looks great. Okay, with SIDS, you want to make sure that you are swaddling correctly. You don't want anything over the face. You don't want anything in their bed. No blankets or pillows or padding. Nothing soft. They need to be on a firm, secure surface. You always want her to sleep on her back. Support her head. All right, Joanne, you have a beautiful baby.
Oh, thank you.
You're welcome. I would document everything. The SIDS was reinforced teaching. This is now her side table. Either of you need anything, or please call me when she has a bowel movement so I can check for color and consistency.
Okay.
Believe that is it.